Have you been noticing changes in people around you? Like someone feeling sad, hopeless, or doesn't get any joy doing activities that used to be fun before? Sounds like depression, right? Maybe that's not all. Sometimes you might have seen them getting worried, afraid, and uneasy. Isn't that a sign of anxiety? Well, in this episode of Health Mantra, we will talk about the most common mental condition issues which are more often being confused with one another. These are depression and anxiety. If you like this video, please subscribe to our channel Health Mantra and don't forget to click on the bell icon. If you ask someone to name two common mental health problems, chances are they will think of anxiety and depression. That's because roughly 50% of people diagnosed with depression will also be diagnosed with an anxiety disorder. However, it is important to get an accurate diagnosis in order to treat the correct conditions. So, what is the link between depression and anxiety? Depression and anxiety can occur at the same time. According to a study, half of the people with either anxiety or depression have the other condition. Depression is the feeling of being sad, down, or upset. It feels like the end of the world. It can be a worrisome concern if the person continues to feel that way for several days or weeks. On the other hand, anxiety can cause fear and worry, and it can happen to anyone, anytime. It's not unusual to experience anxiety before a big event or an important decision. But chronic anxiety can be serious and often leads to irrational thoughts and fears that interfere with our daily life. What are the symptoms of depression and anxiety? Well, physical and emotional symptoms of depression include decreased energy, chronic fatigue, difficulty concentrating, pain, aches, cramps, or gastrointestinal problems without any clear cause, changes in appetite or weight, difficulty in sleeping, persistent feelings of sadness, feeling hopelessness along with thoughts of death or suicide attempts. On the other hand, behavioral changes caused by generalized anxiety disorder include feeling fatigued easily, difficulty concentrating or recalling, muscle tension, racing heart, grinding teeth, sleep difficulties, difficulty controlling worry or fear, and panic. How to get clinical diagnosis of depression and anxiety? Well, there's no single test that can diagnose depression or anxiety. Instead, your doctor will conduct a physical exam along with a depression or anxiety screening test. For this, they'll ask you a series of questions that help them get a better insight into what you have been experiencing. If the results aren't clear, or if your doctor suspects the symptoms may be the result of another condition, they may order tests to rule out the underlying issues. In some cases, general practitioners will refer you to a mental health expert such as a psychiatrist or psychologist if they don't feel equipped to properly manage your symptoms and conditions. What to do when depression and anxiety mix? Depression and anxiety are like two sides of the same coin. The goal of managing depression and anxiety is to create a series of treatment options that can all work together to help to some degree whenever you need to use them. If it turns out that we or somebody around us is suffering from both conditions, there are two ways to get help: counseling and medication. A professional therapist can develop a plan to treat our anxiety and depression at the same time. These therapies include cognitive behavioral therapy, which teaches us to adjust our thoughts and actions. Next is interpersonal therapy that shows you how to communicate better, while problem-solving therapy gives us the skills to manage our symptoms. Apart from this, several types of medication may be used to treat depression, anxiety, or both of them. Your doctor may prescribe antidepressants, anti-anxiety medications, and mood stabilizers to treat the same. It's normal to have ups and downs or to have things you are concerned about. You might be going through a difficult time. Talk to your doctor if these feelings or changes last longer than a week or two. Early treatment is the best way to manage the conditions and find treatments that are effective in the long run. For watching more interesting videos like these, subscribe to our channel Health Mantra.